51. Which of the following is a common comorbidity associated with psoriasis? A. Diabetes. B. Rheumatoid arthritis. C. Hypertension. D. All of the above. Answer: all of the above. Rationale: psoriasis is associated with several comorbid conditions, including diabetes, rheumatoid arthritis, and hypertension. These conditions share inflammatory pathways with psoriasis. 52. Which of the following types of psoriasis is most commonly triggered by an upper respiratory infection? A. Guttate psoriasis. B. Plaque psoriasis. C. Pustular psoriasis. D. Inverse psoriasis. Answer: guttate psoriasis. Rationale: guttate psoriasis often occurs after an upper respiratory infection, particularly a streptococcal throat infection. 53. What is the primary role of phototherapy in the treatment of psoriasis? A. To decrease inflammation and reduce skin cell turnover. B. To moisturize the skin. C. To cure psoriasis permanently. D. To treat fungal infections. Answer: to decrease inflammation and reduce skin cell turnover. Rationale: phototherapy, UVB therapy, helps to decrease inflammation and slow the rapid turnover of skin cells in psoriasis. It does not moisturize the skin or cure psoriasis permanently. 54. What is the most likely trigger for psoriasis flare-ups in patients with a history of guttate psoriasis? A. Stress. B. Upper respiratory infection. C. Sunburn. D. Cold weather. Answer: upper respiratory infection. Rationale: guttate psoriasis is commonly triggered by an upper respiratory infection, particularly a streptococcal throat infection. 55. Which type of psoriasis affects the skin folds, such as the armpits and groin? A. Inverse psoriasis. B. Plaque psoriasis. C. Pustular psoriasis. D. Guttate psoriasis. Answer: inverse psoriasis. Rationale: inverse psoriasis affects the skin folds, including the armpits, groin, and under the breasts. It is characterized by smooth, red, inflamed patches. 56. Which of the following is a common topical treatment for mild to moderate psoriasis? A. Calcipotriene. B. Biologic therapy. C. Methotrexate. D. Cyclosporin. Answer: calcipotriene. Rationale: calcipotriene is a topical vitamin D analog commonly used to treat mild to moderate psoriasis. Biologics, methotrexate, and cyclosporin are systemic treatments for more severe psoriasis. 57. Which of the following should be monitored when a patient is receiving systemic treatment with methotrexate for psoriasis? A. Liver function. B. Blood pressure. C. Renal function. D. Both A and C. Answer: both A and C. Rationale: methotrexate can cause liver toxicity, so liver function must be monitored regularly. It can also affect kidney function, so renal function should be monitored as well. 58. Which of the following is true regarding the use of biologics in psoriasis treatment? A. They are used for severe, refractory psoriasis. B. They are only effective in treating joint involvement. C. They are topical treatments. D. They are used as first-line treatments for all psoriasis patients. Answer: they are used for severe, refractory psoriasis. Rationale: biologics are generally used for severe or refractory psoriasis that does not respond to other treatments. They are systemic therapies and are not used as first-line treatments for all patients. 59. Which of the following factors can increase the risk of psoriasis flare-ups? A. Alcohol consumption. B. Smoking. C. Stress. D. All of the above. Answer: all of the above. Rationale: alcohol consumption, smoking, and stress are all known triggers that can increase the risk of psoriasis flare-ups. 60. Which of the following medications may be used to treat severe, generalized pustular psoriasis? A. Methotrexate. B. Oral retinoids. C. Biologic therapy. D. Topical corticosteroids. Answer: methotrexate. Rationale: methotrexate is commonly used to treat severe, generalized pustular psoriasis. Biologics can also be used for severe cases, while oral retinoids may be considered for certain forms of pustular psoriasis. 61. In which layer of the skin does psoriasis primarily affect? A. Epidermis. B. Dermis. C. Hypodermis. D. Subcutaneous tissue. Answer: epidermis. Rationale: psoriasis primarily affects the epidermis, where there is abnormal proliferation of skin cells. This leads to the formation of plaques and scales on the skin surface. 62. Which of the following is a common comorbidity in patients with psoriatic arthritis? A. Obesity. B. Hypertension. C. Diabetes. D. All of the above. Answer: all of the above. Rationale: psoriatic arthritis is associated with an increased risk of obesity, hypertension, and diabetes due to shared inflammatory pathways. 63. Which of the following is an appropriate intervention for a patient with mild psoriasis of the scalp? A. Coal tar shampoo. B. Systemic methotrexate. C. Biologic therapy. D. Topical corticosteroid injections. Answer: coal tar shampoo. Rationale: coal tar shampoo is commonly used to treat mild psoriasis of the scalp. Systemic treatments and biologics are generally reserved for more severe cases. 64. Which of the following is a potential side effect of systemic retinoids used in psoriasis treatment? A. Birth defects in pregnant women. B. Increased appetite. C. Skin darkening. D. Dizziness. Answer: birth defects in pregnant women. Rationale: systemic retinoids, such as acitretin, are teratogenic and can cause birth defects, so they should not be used during pregnancy. Other side effects like increased appetite are not as common. 65. Which of the following best describes the appearance of plaque psoriasis? A. Raised, red patches with silvery scales. B. Small, red, drop-like lesions. C. Pustules filled with pus. D. Smooth, shiny red patches. Answer: raised, red patches with silvery scales. Rationale: plaque psoriasis is characterized by raised, red patches covered with silvery scales. Other forms of psoriasis have different appearances. 66. What is the mechanism of action of topical corticosteroids in psoriasis treatment? A. Suppression of the immune response to reduce inflammation. B. Stimulation of the immune system to reduce symptoms. C. Inhibition of bacterial growth. D. Promotion of skin cell turnover. Answer: suppression of the immune response to reduce inflammation. Rationale: topical corticosteroids suppress the immune system, which helps reduce inflammation in psoriasis. They do not stimulate the immune system or promote skin cell turnover. 67. Which of the following conditions may worsen psoriasis symptoms in a patient? A. Upper respiratory infections. B. Sun exposure. C. Topical emollients. D. All of the above. Answer: upper respiratory infections. Rationale: upper respiratory infections, especially streptococcal infections, can trigger psoriasis flare-ups. Sun exposure may actually improve symptoms for some people, and emollients help manage dryness and irritation. 68. Which of the following medications is used for its immunosuppressive effect in the treatment of moderate to severe psoriasis? A. Methotrexate. B. Cyclosporin. C. Biologics. D. All of the above. Answer: all of the above. Rationale: methotrexate, cyclosporin, and biologics all work by suppressing the immune system, helping to control the inflammation and skin cell turnover seen in moderate to severe psoriasis. 69. What is the key difference between plaque psoriasis and guttate psoriasis? A. Plaque psoriasis involves large, raised lesions with silvery scales, while guttate psoriasis involves smaller, drop-like lesions. B. Guttate psoriasis is only found on the scalp, while plaque psoriasis affects the entire body. C. Plaque psoriasis is more likely to occur after an infection than guttate psoriasis. D. There is no difference between plaque psoriasis and guttate psoriasis. Answer: plaque psoriasis involves large, raised lesions with silvery scales, while guttate psoriasis involves smaller, drop-like lesions. Rationale: plaque psoriasis is characterized by large, raised lesions with silvery scales, while guttate psoriasis consists of smaller, drop-like lesions that often appear suddenly, typically after an infection. 70. Which of the following conditions can be associated with pustular psoriasis? A. Hypercalcemia. B. Hypokalemia. C. Hypoglycemia. D. Hypernatremia. Answer: hypercalcemia. Rationale: pustular psoriasis can lead to hypercalcemia due to the rapid turnover of skin cells and inflammation. Hyperkalemia, hypoglycemia, and hypernatremia are not typically associated with pustular psoriasis. 71. Which of the following is considered a first-line systemic treatment for moderate to severe psoriasis? A. Methotrexate. B. Phototherapy. C. Topical steroids. D. Cyclosporin. Answer: methotrexate. Rationale: methotrexate is considered a first-line systemic treatment for moderate to severe psoriasis. Other treatments like phototherapy and topical steroids are used for less severe cases. 72. What is the characteristic appearance of nail psoriasis? A. Pitting, thickening, and discoloration of the nails. B. Redness and swelling around the nails. C. Loss of nail color. D. Black spots on the nails. Answer: pitting, thickening, and discoloration of the nails. Rationale: nail psoriasis often causes pitting, small indentations, thickening, and discoloration of the nails, which are distinctive features of the condition. 73. Which of the following is the main cause of death in patients with severe psoriasis? A. Liver failure. B. Cardiovascular disease. C. Respiratory failure. D. Renal failure. Answer: cardiovascular disease. Rationale: psoriasis is associated with an increased risk of cardiovascular disease, particularly in severe cases. Inflammation is thought to contribute to this increased risk. 74. Which of the following is an effective measure to prevent psoriasis flare-ups? A. Maintaining a healthy weight and avoiding smoking. B. Using topical corticosteroids frequently. C. Eating a high-fat diet. D. Engaging in vigorous exercise daily. Answer: maintaining a healthy weight and avoiding smoking. Rationale: maintaining a healthy weight and avoiding smoking can help reduce the frequency of psoriasis flare-ups. Topical corticosteroids should be used as directed, and a balanced diet is important. 75. What is the most common site for plaque psoriasis to develop on the body? A. Scalp. B. Elbows and knees.
C. Chest.
D. Abdomen. Answer: elbows and knees. Rationale: plaque psoriasis most commonly develops on the elbows and knees, where friction and irritation can trigger flare-ups. 76. Which of the following best describes the role of TNF-alpha inhibitors in psoriasis treatment? A. They block the inflammatory signals that drive psoriasis. B. They promote the growth of skin cells. C. They provide immediate relief from itching. D. They act as antibiotics to prevent infections. Answer: they block the inflammatory signals that drive psoriasis. Rationale: TNF-alpha inhibitors are biologic medications that block tumor necrosis factor, TNF-alpha, a key inflammatory cytokine involved in the development of psoriasis. 77. Which of the following is a potential side effect of cyclosporin used for psoriasis treatment? A. Kidney damage. B. Increased hair growth. C. Hyperpigmentation of the skin. D. Diarrhea. Answer: kidney damage. Rationale: cyclosporin can cause kidney damage and renal function must be monitored closely during treatment. Other side effects like increased hair growth or hyperpigmentation are less common. 78. What is the most common age of onset for psoriasis? A. 30 to 40 years.
B. 50 to 60 years.
C. 20 to 30 years. D. 10 to 15 years. Answer: 20 to 30 years. Rationale: psoriasis most commonly develops in individuals between the ages of 20 and 30, though it can occur at any age. 79. What is the most important consideration when prescribing a biologic for psoriasis treatment? A. Monitoring for signs of infection. B. Monitoring for liver toxicity. C. Monitoring for gastrointestinal bleeding. D. Monitoring for renal function. Answer: monitoring for signs of infection. Rationale: biologics suppress the immune system, which increases the risk of infections. Monitoring for signs of infection is critical during treatment. 80. Which of the following is a key characteristic of erythrodermic psoriasis? A. Widespread redness and shedding of skin. B. Raised plaques with silvery scales. C. Nail pitting.
D. Blistering of the skin.
Answer: widespread redness and shedding of skin. Rationale: erythrodermic psoriasis is characterized by widespread redness, shedding of skin, and inflammation. It is a severe and potentially life-threatening form of psoriasis. 81. What is the most common form of psoriasis? A. Guttate psoriasis. B. Pustular psoriasis. C. Plaque psoriasis. D. Erythrodermic psoriasis. Answer: plaque psoriasis. Rationale: plaque psoriasis is the most common form, affecting about 80 to 90% of people with psoriasis. It is characterized by raised, red patches covered with silvery scales. Guttate psoriasis, pustular psoriasis, and erythrodermic psoriasis are less common. 82. Which of the following is a common trigger for psoriasis flare-ups? A. Emotional stress. B. Increased water intake. C. Excessive exercise. D. Cold weather. Answer: emotional stress. Rationale: emotional stress is a well-known trigger for psoriasis flare-ups, as it can induce inflammation and immune system responses. Cold weather can also worsen psoriasis, but stress is a more direct and common trigger. 83. Which of the following is a potential side effect of methotrexate used in psoriasis treatment? A. Hair loss. B. Weight gain. C. Liver toxicity. D. Insomnia. Answer: liver toxicity. Rationale: methotrexate is known to have potential side effects including liver toxicity, which is why liver function is regularly monitored during treatment. Hair loss can occur in some cases, but liver toxicity is a more significant concern. 84. Which of the following is the primary mechanism of action of biologics in psoriasis treatment? A. Suppressing the immune system to reduce inflammation. B. Killing bacteria that cause skin infections. C. Reducing the rate of skin cell turnover. D. Increasing blood flow to the skin. Answer: suppressing the immune system to reduce inflammation. Rationale: biologics target specific components of the immune system, such as TNF-alpha or interleukins, to reduce inflammation. They do not directly kill bacteria or affect blood flow or skin cell turnover in the same way. 85. Which of the following is a characteristic feature of inverse psoriasis? A. Thick, scaly plaques. B. Red, smooth patches in skin folds. C. Extensive skin shedding. D. Nail discoloration. Answer: red, smooth patches in skin folds. Rationale: inverse psoriasis occurs in skin folds, such as underarms, groin, and under the breasts, and presents as red, smooth patches. It is less scaly than other forms of psoriasis. 86. What is a common comorbidity associated with psoriasis? A. Diabetes mellitus. B. Asthma. C. Tuberculosis. D. Osteoarthritis. Answer: diabetes mellitus. Rationale: psoriasis is associated with an increased risk of metabolic conditions such as diabetes mellitus due to chronic inflammation. Asthma, tuberculosis, and osteoarthritis are not as strongly linked to psoriasis. 87. Which type of psoriasis is characterized by small, drop-like lesions on the skin? A. Guttate psoriasis. B. Pustular psoriasis. C. Plaque psoriasis. D. Erythrodermic psoriasis. Answer: guttate psoriasis. Rationale: guttate psoriasis is characterized by small, drop-shaped lesions that can appear suddenly, often triggered by a streptococcal throat infection. 88. Which of the following treatments is typically used for localized psoriasis? A. Oral steroids. B. Topical corticosteroids. C. UVB phototherapy. D. Biologic agents. Answer: topical corticosteroids. Rationale: topical corticosteroids are the first-line treatment for localized psoriasis as they reduce inflammation and slow skin cell turnover. Oral steroids and biologic agents are typically used for more widespread or severe cases. 89. Which of the following is a characteristic feature of pustular psoriasis? A. Widespread plaques. B. Small pus-filled blisters on red skin. C. Nail pitting. D. Skin redness without scaling. Answer: small pus-filled blisters on red skin. Rationale: pustular psoriasis is characterized by the presence of pus-filled blisters surrounded by red skin. It can be localized or generalized, but the key feature is the pustules. 90. What is the most common systemic treatment used for moderate to severe psoriasis? A. Topical corticosteroids.
B. Cyclosporin.
C. Methotrexate. D. Phototherapy. Answer: methotrexate. Rationale: methotrexate is commonly used as a first-line systemic treatment for moderate to severe psoriasis. Cyclosporin, while effective, is typically used in more severe cases or when other treatments fail. 91. What is the primary role of ultraviolet (UV) light in the treatment of psoriasis? A. To kill bacteria on the skin. B. To increase skin cell turnover. C. To reduce inflammation and slow cell turnover. D. To enhance the effect of topical medications. Answer: to reduce inflammation and slow cell turnover. Rationale: UV light, especially UVB phototherapy, helps slow the rapid turnover of skin cells and reduces inflammation, making it an effective treatment for psoriasis. 92. Which of the following is a common side effect of cyclosporin in psoriasis treatment? A. Skin rash. B. Kidney toxicity. C. Weight loss. D. Increased hair growth. Answer: kidney toxicity. Rationale: cyclosporin can cause kidney toxicity, so renal function is monitored regularly during treatment. It can also cause high blood pressure, but is less commonly associated with the other listed side effects. 93. Which of the following best describes erythrodermic psoriasis? A. Characterized by small, red spots. B. Widespread redness, scaling, and shedding of skin. C. Large, thick plaques covered with scales. D. Areas of skin that crack and bleed. Answer: widespread redness, scaling, and shedding of skin. Rationale: erythrodermic psoriasis is the most severe form, presenting with widespread redness, scaling, and skin shedding. It can be life-threatening and requires urgent treatment. 94. Which of the following is a common manifestation of nail psoriasis? A. Thickened, pitted nails. B. Oozing sores on the nails. C. Yellow discoloration of nails. D. Painful swelling of the nail bed. Answer: thickened, pitted nails. Rationale: nail psoriasis is characterized by thickening, pitting, and discoloration of the nails, which can lead to nail separation in severe cases. 95. Which of the following is the primary function of the immune system in psoriasis? A. Causing inflammation that accelerates skin cell turnover. B. Triggering an infection in the skin. C. Reducing blood flow to affected areas. D. Stimulating hair growth. Answer: causing inflammation that accelerates skin cell turnover. Rationale: psoriasis is an autoimmune condition where the immune system triggers inflammation that accelerates the turnover of skin cells, leading to the characteristic plaques. 96. Which of the following treatments is most commonly used for severe, resistant psoriasis? A. Topical corticosteroids. B. Biologic agents. C. Retinoids. D. Methotrexate. Answer: biologic agents. Rationale: biologic agents are often used for severe, resistant psoriasis, particularly when other treatments like topical corticosteroids or methotrexate are ineffective. 97. What is the main cause of death in patients with severe psoriasis? A. Liver failure. B. Cancer. C. Cardiovascular disease. D. Respiratory failure. Answer: cardiovascular disease. Rationale: psoriasis, particularly severe forms, is associated with an increased risk of cardiovascular disease, which is the main cause of death in these patients. 98. Which of the following is a potential risk of using topical steroids for psoriasis? A. Skin thinning. B. Excessive hair growth. C. Weight gain. D. Diabetes. Answer: skin thinning. Rationale: prolonged use of topical steroids can cause skin thinning, which is a known side effect. Other side effects like excessive hair growth or diabetes are more likely with systemic steroids. 99. What is the most likely outcome of untreated severe psoriasis? A. Increased skin infections. B. Permanent skin damage. C. Spontaneous remission. D. Rapid skin cell turnover. Answer: permanent skin damage. Rationale: if severe psoriasis is left untreated, it can lead to permanent skin damage, including thickened skin and scarring. Skin infections and other complications can also arise, but permanent damage is the most likely consequence. 100. Which of the following is the best way to manage scalp psoriasis? A. Applying moisturizing oils. B. Using antifungal shampoos. C. Topical corticosteroids. D. Avoiding hair washing. Answer: topical corticosteroids. Rationale: topical corticosteroids are the most effective treatment for scalp psoriasis as they reduce inflammation and scaling. Antifungal shampoos and moisturizing oils may help, but corticosteroids are typically more effective.